I don't have pain. No. También ya se me quitó el dolor de la cabeza.
What about your cheeks? Are they still red? Or are you feeling hot?
Yes, they're still a little. They woke up red, pero ya se me quitó.
You still want to go to your parents?
No, baby, I'm fine. Just, I dropped a pill. And thanks. I haven't in a while. Es la medicina.
All for you.
Yeah. Have you not noticed that? That's a pattern.
It's a pattern?
Mm-hmm.
Oh. I'm going to put it
I need to eat. I'm getting drowsy.
What?
Es que me la tomé hace rato. Oh, I have it right here. De todos modos, ya me duermo. After 2 hours of being awake, I go back to sleep. That medicine is strong. Ugh. He guards my coffee. What's his name? I put him there. Have you seen him?
Yeah.
It's his job. Nope. Make sure nothing happens to it.
Nobody got anything?
Nope. Like my boyfriend sometimes that likes to steal my coffee. Actually, you probably... Huh?
You use mine.
Yeah, because everything that yours is mine and what mine is mine. He's probably your accomplice, to be honest with you. Oh. I am just making a mess today. It's okay, I just got out of the hospital. I have a good reason to. Thank you for guarding it. I keep making messes, but I don't know what's going on. That's all the meds. We're gonna blame it on the meds. We blame anything on the meds. I need to eat. I'm getting drowsy. Hey there, I'm Eunice, and I suffer from chronic illnesses. I have kidney failure, stage 3, seizures. Something's going on with my heart or my lungs. I'm not really sure. Pain and other side effects like that. And today I want to go about my last vlog. It's like the second part of it where I have all the side effects and things we unfortunately go through as we take medication. But I want to do it outside because I'm tired of being inside, and I honestly have to stay away from people as much as I can because the medication is very strong. I'll explain as I go, but let's go outside. So I wanted to talk about what happened yesterday. I got the infusion, right, from my doctor. I got rituximab, they also call it, and it's an infusion. So I also got Tylenol, Benadryl, Pevcet, and methylprednisone with sodium. That was an injection as well. I know prednisone, but I don't think it's the same medication that I've had before. Maybe it is, I don't know. I do see my cheeks bigger than usual, so maybe it is prednisone. All this medication gives you so many side effects. It gives you weight gain, pain, and all that kind of stuff. And then it also says that I got Rituxan. It talks about the allergies I have, which ironically Rituxan is one of them. And then over here, oh, the air feels so good. So it's so funny how whenever you get sick and stuff, you just get thankful about like little stuff like that, you know, because I don't really go out anymore due to my health, because I can get sick really easily right now, and it could be dangerous for me. So I always have to wear a mask now. So rituximab treats leukemia and lymphoma. That's what it's mostly used for. It works by blocking protein that causes cancer cells to grow and multiply. This helps to slow down or stop the spread of cancer cells. It may also be used to treat autoimmune conditions such as arthritis. It works by slowing down an overactive immune system. It is a monoclonal antibody. So us with kidney failure, that's what they give us as well too. So in other words, they realized, I believe this was like 5-7 years ago, but that they realized that this medication would also worked on us. People like me that have like kidney failure and pain, but the ironic part And then it says, what should I tell my doctor before I take this medication? Chest pain, I got that. Heart disease, I have no idea if I have that. Immune system problems, I got that. Infections such as chickenpox, cold sores, hepatitis or herpes, irregular heart rhythm, I got that. Kidney disease, I got that. Low blood count such as low white cells, pallets, red cells, I have no idea, but it sounds like I got that. Lung disease, I'm not sure, we're trying to figure that out. Recent upcoming vaccine and unusual allergic reaction to rituximab, other medications, foods, days, and preservatives. I got that. I'm allergic to Rituxan. Pregnant or trying to get pregnant, breastfeeding. I'm not that. And plus, every time before I got the infusion, they would give me a pregnancy test just in case. And then it says, how should I use this medication? This medication is injected into the vein. It is given by a care team in a hospital or a clinic setting. A special med guide will be given to you before the treatment. Be sure to read this information carefully each time. Talk to your team about this medication in children. Well, this medication may be prescribed for children as young as 6 months. That is crazy. 6 months. And it's such a hard medication. It's really rough. For selected conditions, precautions may apply. Overdosage. If you think you have taken too much of this medicine, contact a poison control center or an emergency room at once. Note, this medicine is only for you. Do not share this medication with others. Sorry, my mom went just like, you're the one that's giving it to me. How am I going to share it? Not that I would ever do that, but that's just, even from like the video, you know what I mean. Oh, a chigger. I haven't seen a chigger in a long time. Oh, I used to see those at camp all the time. All right, it says, what if I miss a dose? Keep appointments for follow-up doses. It is important you do not miss a dose. Call your care team if you're unable to keep your appointment. And then over here's the fun part. What may interact with this medication? Do not take this medication if you have any of the following. Live vaccine. That's the door. This medication can also interact with the following. Cipelantin, cipelanine, cipelanine. I have no idea how to say that. This list may not describe all possible interactions. Give your health team provider a list of all the medications that you take, prescription drugs, or dietary supplements you use. Also tell them that if you smoke, drink alcohol, or use illegal drugs. Some items may interact with your medicine. What should I watch while using this medication? Which this is what I read last night because I was seeing all like different symptoms on me as well. Your condition may be monitored carefully while you're receiving this medication. You may need blood work while taking this medication. This medication can cause serious infusion reactions. To reduce the risk, your care team may give you other medications to take before receiving this one. That's the medications I talked about at the beginning of this video. Be sure to follow directions from your care team. This medication may increase the risk of getting an infection. Call your team for advice if you have fever, chills, sore throat, or other symptoms of cold or flu. Do not treat yourself. Try to avoid being around people who are sick. AKA, this is why I'm home a lot now and I use a mask when I'm out and about. But I try not to, unless maybe once a week or once every 2 weeks, because it's really hard being at the house and you can only do so much, you know, and also my body only lets me do so much. Last time we went to Home Goods and I could only walk a couple steps and I had to sit down. Would be really out of breath. Like my body can't take it no more. Same with moving things around the house, like if I'm cleaning or something like that, I can't do it. Call your care team if you are around with anyone with measles, chickenpox, or if you develop sores or blisters that do not heal properly. No, sorry, I just started thinking about my body. Avoid taking medications such as aspirin, acetaminophen, however you say that, ibuprofen, naproxen, or ketamorphin, ketoprofen, naproxen. I'm gonna put all those words here. Unless instructed by your care team. These medications may hide a fever. This medication may cause serious skin reactions. They can happen weeks to months after starting the medication. Contact your care team right away if you notice fevers or flu-like symptoms with a rash. This rash may be red or purple and then turn into blisters and peeling of the skin. You may also notice a red rash with swelling of the face, lips, or lymph nodes on your neck under your arms. Which that's right now I have makeup on, but yesterday you could see it like around here. And this is why I started freaking out yesterday, because I'm like, oh shit, something's happening. You may also notice red rash with swelling of the face. My face is swollen. Like, I was trying to do a video today, and I saw my face, and I'm like, it's getting really swollen. This right here, it's not normal for me. I don't have a double chin, and I'm also gaining a lot of weight due to the medications. We'll get back to it soon, though. I'm not worried about that. I'm just letting my body heal how it needs to heal. You see, that kind of scared me a bit. So maybe I should tell the doctors that? Should I tell the doctors that? I took a photo and a video as well. In some patients, this medication may cause serious brain infection that may cause death. That's what I was talking about in the other video when I signed. If you have any problems seeing, thinking, speaking, walking, or standing, tell your care team right away. You cannot reach your care team urgently, seek another source of medical care. I already have trouble getting my thoughts together due to my seizures. Again, sorry I laugh so much in moments like this. That's just nervousness and like me thinking like, well, shit. Like, add another thing to the fucking list. I already have, my balance is really off. And you've seen in a lot of videos. I'm pretty sure I already posted a video where I fell down. I've fallen down 2 times this year already. Talk to your care team if you may be pregnant, serious birth defects occur. That's about pregnancy, I'm not pregnant. What side effects may I notice from receiving the medication? Side effects that you should report to your care team as soon as possible. Allergic reactions or angioedema. I'm the worst at pronouncing things, by the way, just in case you don't know. Now you're knowing this. Skin rash, itching, hives, swelling of the face, eyes, lips, tongue, arms, legs, trouble swallowing and breathing. But you see, the problem here is that I'm already swollen because my kidneys are not working. So where's the middle ground? You know what I'm saying? I'm all over swollen, and the medicine makes me more swollen, so I don't know. And then I have the appointment until either 3 or 4 months, and in 2 months they're gonna do blood work. 2 months, a month, they're gonna do blood work. Bowel blockage, stomach cramping, unable to have a bowel movement, pass gas, loss of appetite, vomiting. So yesterday in the morning, my stomach up here was hurting really badly. And I kid you not, this is TMI, but with bowel movements, it's been little by little. And I haven't been able to do like the normal amount. But then again, all my medications cost. There's a word for it, I'll put it here. It's just so hard, like, where do you know the balance of it all? I also vomit sometimes because the medication is so hard on me, like my other medications. It also says dizziness, loss of balance, I have that. Coordination, I have that sometimes. Confusion, I have that sometimes. And trouble speaking, I also have that sometimes because of my seizures. A heart attack, oh good lord. Pain or tightness of the chest, shoulders, arm, jaw, nausea, shortness of breath, cold, and clammy feeling, faint or lightheaded. And then it also says heart rhythm changes, fast or irregular heartbeats, dizziness, feeling faint or lightheaded, chest, trouble breathing. I have that already. It's just infection, fever, chills, cough, sore throat, wounds that do not heal, pain or trouble when passing urine, general feeling discomfort or being unwell. I have that. Infusion reactions, chest pain, shortness of breath, trouble breathing, feeling faint or lightheaded. I have that. Kidney injury, decreasing the amount of urine, swelling of the ankles, hands, or feet. I have that. Liver injury, right upper belly pain, loss of appetite, nausea, light colored stool, dark yellow or brown urine. I have yellowing skin or eyes, unusual weakness or fatigue. I have that. I'll show you. I'll see if I can find all the dogs just started barking. I'll see if I can find a photo of me where I'm very yellow. Also yelling of the skin. When I'm getting very sick, I do get really yellow. When does unusual weakness come to be normal? Because I've had weakness for almost a year now. So when is the right amount for them to finally fucking pay attention to me with my other problems? I mean, my kidneys are getting there in a way, right? And my seizures, I had a seizure, it's been 2 weeks now. But they're getting there, they're not as bad anymore. Redness, blistering, peeling, loosening of the skin, including inside the mouth. That's terrifying. Stomach pain that is severe, it does not go away, it gets worse. Tumor Lysis syndrome, TLS. Nausea, vomiting, diarrhea, decreasing the amount of urine, dark urine, unusual weakness or fatigue, confusion, muscle pain, cramps, fast or irregular heartbeat, joint pain. I have nausea, I have vomiting, I don't have diarrhea. I have noticed a little decrease on the amount of urine I do. It has become a little dark. But it doesn't have foam anymore, so that's good. Like, just a little sometimes only. Unusual weakness or fatigue, I have that. Confusion, I have that. Muscle pain, I have that. Cramps, I got that. Faster, so I got I got most of them except one. Side effects, usually they do not require medical attention. Report to your care team if they continue or it's bothersome. Headache, I have that, and it's always on the left side of my brain. Joint pain, I have that. Nausea, I have that. I do have a runny and stuffy nose sometimes. Unusual weakness or fatigue, I have that. This list may not describe all the possible side effects. Call your doctor for medical advice and side effects. You may report the side effects to the FDA. So whenever you do that, because I've done that before, unfortunately, you call them and it's like the 24 line essentially, and you're kind of debating if you should go to the ER or not. Because I have most of this, they're like, yeah, you should go to the ER. But you go to the ER and you look like this. I look normal. I'm just, my body and I guess in a way my mind too is so used to the pain that I just look like this. And I'm not either fainted at the moment because the moment has passed, or I'm not having a seizure at the moment because the seizures have passed. Sometimes it has happened where they caught me. Last time, my video that I posted where I was in the ER, I was in the hospital, is because they caught it. It happened in front of them. That's the only way they listen to you. If not, you have to wait for like maybe 24 to 48 hours in the ER, and that's just crazy. And it says, where should I keep my medication? This medication is given in the hospital or clinic. It will not be stored at home. This sheet is a summary. It may not cover all the possible information. If you have any questions about this, talk to your doctor, pharmacist, or healthcare provider, and that's it. But it's just a little worrisome. You know what I'm saying? I wanted to feel pretty, so I did my makeup because I want to feel pretty and because I've been going through shit. And I've also been filming some other like TikTok videos and stuff like that. But yeah, guys, so that's the description. And most of the papers, like I can also try to find other papers that essentially it says the same thing. If you feel like this, go to the ER. If you feel like that, go to the ER. And it's just a never-ending circle. And like where is the point where I go to the ER? And it's really hard on your mind because of how much you get pushed out or pushed away, and then they see your file and they're like, it's just a reaction of this, or it's just a reaction of that, you know. And it's really saddening to hear, like, oh my god, my cheeks are really bothering me. Like, I feel like I'm on prednisone, to be honest with you. And here's a photo of me, we're in prednisone. But it's so contradictive, and it messes up with your own limit in a way. Though all this experience that I've had in this relapse, it has helped me understand more of my balance of when it's too much, and then when I really need to vouch for myself and be like, hey, I am not okay even though I look well. And you essentially come with harder force in the system, and it's so saddening how it can be, you know. This video, I want to do this so people can understand how hard it is to be sick and not being paid attention to, or not being described the correct way. The things, like, I actually have to look a lot of things up, or sometimes they don't answer. They say you can contact them, but sometimes they don't answer, to be honest with you. Or even sometimes you call them and they hang up. So they're useless. So I had to learn a lot for myself, and I also have friends that are in the medical field that really helps me a lot. So I'm very, very thankful for that. It's just so contradicting. It's a never-ending circle that is very toxic between the patient and the medical field. And I always say this: it's not a right or wrong. It's about doctors being open to new ideas and willing to look more into things, not just the basic stuff, and patients being heard and having the time that they need to describe things. Because most of the time the doctors are like, we gotta go, we got 15 minutes, we gotta go. And they don't really pay attention to the patient. And then the patient feels gaslighted in a way. And they get worse and worse and worse until you're in, unfortunately, a life or death situation. Sometimes they have new doctors and they think it's just about the books. And I'm pretty sure I've told stories in my other videos with what has happened, and I'm more than happy to do more videos on that, where I'm honestly traumatized with, I do not like new doctors or nurses for that same reason, because they have damaged me really badly. I always ask, how long have you been doing this, because I don't want somebody new. And back in the day I used to be like, okay, yeah, fine, you're learning, I'm okay with it. No, not anymore. They've hurt me so much that I'm like, no thank you. Or I need somebody else that's higher than them looking over their shoulder to make sure they come in, because it's my body and I feel safe that way. So it's just about teamwork and learning from both sides on how to work together. And so doctors are not so stressed out. The amount of people they see a day, like The Pit, the show that's been happening, that's the best show that I've seen, that where I've actually seen in real life as a patient how things are. And the amount of things that doctors have to do is so much, and it's so much in their brain, and they have to focus from one thing to another like that. And it's just so much for them. I believe there has to be a better way. I believe they need more sleep. They tell us to get sleep to recover. They should too, because there could be a malpractice right there. And I have had malpractices too that I could have sued, but I just decided not to. But it's getting to that point where I'm getting really upset that I'm like, do I need to go that route? You know what I mean? And it might make a difference that it's not okay for us patients to be treated that way. And also, like, I've seen their fatigue, and it's just crazy. And I'm like, hey, are you paying attention to me? This is my body. I understand you're tired, but I'm dying. Help me. You know, what's the best option for me to live a little longer? They need to take care of themselves, and we need to take care of themselves and work as a team and put our brains together so we can make the healthcare system and us as human, the people that are sick, a better community, or be friends, I guess. It's not about fighting and anything else, or I don't even know how to describe it. It's about working together. But sometimes, unfortunately, you have to push a little because they're pushing you, you know, and defend yourself. That's all I have to say for this video. I hope you guys have a wonderful one. You guys are having a good day, especially spring is out. Enjoy the weather. There's been some tornado warnings out here. Drink your water and stay healthy, guys. Enjoy life, even little things. I'm enjoying doing videos now, editing them and getting my life a little together. Hopefully soon I can start working out, and I'll try my best to film that as I go little by little. I'll give you some more information about my body and stuff, and what I'm gonna do, what's my plan as I get myself back into stabilizing my body and making it strong again. So those videos will be coming soon as well. But yeah, guys, thanks for staying, listening to me vent about some medical stuff of mine. So us as people that have an invisible illness that we need to be listened to too. But I hope you guys are doing well. Enjoy, like I said, enjoy the outside. You guys that are able to. To be honest, just being out here for a second makes me feel really good. I miss being outside and being able to work out and looking at the beautiful sunrises, sunsets, and just being able to have time for myself and my loved ones. Seeing them more, but I can't at the moment. But I'll be alright. I'm transforming into a new person, and I welcome the new Eunice with my open hands. Like I said, take care of yourselves, and I'll see y'all later.